Hey there, everybody. I'm making this video in reference to FAI and labral tears for femoral acetabular impingement, or what my people call cam and pincer impingement, for your hip. I am, by the way, my name is Eric, and I have FAI in both hips. Um, I had surgery on my left hip with a Dr. Ochi from Nursery Orthopedics in Reston, Virginia, yesterday at 7 a.m. and today is about 1:47, so a little bit over a day ago. I had the surgery, and so far right now I'm feeling pretty good. No pain meds. Um, Pretty smooth surgery. I had a nerve block as well as general anesthesia. So my leg is still pretty numb, so that's curbing some of the pain. Um, and I just got home from a 3.5 hour drive, so overall not too bad. I've had the surgery before, so I know what to expect. So it's not been too bad. I just wanted to create a video so everybody on the Facebook page can keep tabs, ask questions from somebody who's had the surgery, who has rehabbed it, and as well give you guys a video log of exercises and PT that you can do at home to help in rehabbing this hip. Um, I know a lot of people don't get a lot of physical therapy visits, and half the battle is doing the physical therapy, not just the surgery. The surgery is the main part, and having a great surgeon do that is the first part, and the rehab is the second part. So, by any means, I recommend Dr. Ochi. Great doctor, answers all your questions. Is probably one of the top hip specialists in the country. Writes books on the condition. And I guess if I can just sit down and give you guys a little bit of an overview of what FAI is, in layman's terms, rather than the femoral acetabular impingement, it might make it a little bit more understanding for people. So, your hip is comprised of femur, which everybody knows is a ball and socket, and your socket is called your acetabulum or acetabular. And around the rim of your socket is a bumper, what we call the labrum. You also have this in your shoulder, which I have as well tore multiple times. Some of it's genetic, some of it is due to bony aspects, and some of it is also due to EDS, or what people call Ehlers-Danlos syndrome. So those play a lot of different parts when getting checked and evaluated for this type of surgery. Um, First off, FAI can definitely be a pain in your butt, literally, if you have a posterior tear, as well as groin pain on a daily basis with exercising, sitting, anything that involves your hip, because it is a load weight bearing portion of your body. So I've had three surgeries on my right, and hopefully this is the only one I will be having on my left. I had three anchors placement in my anterior aspect. I had a psoas lengthening, and I had a little bit of fraying in the back that just needed cleaned up. Nothing major, and it was better that I got it taken care of now than down the road. And I had a capsulation, which a lot of doctors in hip arthroscopy have been not actually doing after this type of surgery, which happens to create micro instability in people. And a lot of people end up re-tearing this type of surgery after they have it fixed, because their hip is no longer stable. And you really have to have a strong hip, and those ligaments, the three ligaments that are comprised of holding your hip in order to not really tear that labrum. So I had that done as well, since my last surgeon didn't close my hip capsule, and it caused a re-tear on my right side. And luckily I was able to get that fixed by Dr. Ochi as well, which I'm still recovering from 4.5 months later. So I've got a road ahead of me. It's been a little hard because I do have a tear in my disc in my S1. So it's a little bit of a pain, literally, but I'll be able to get through it. So, some key things to take from having this surgery is it's not a slow one to recover from. A lot of it depends on how healthy you were before, um, how strong you were, athletic. A lot of those things do come into play. A lot of people don't think that, but they do. So be in the best shape you can beforehand, and if you can do physical therapy before to strengthen as much as you can, will really help afterwards. Um, a good diet. You got to have a real good diet after this. Your body's healing, you need sleep, and you also need to eat really well. High protein diet. I'd recommend taking a probiotic supplement. It helps with the constipation, the number two, um, which a lot of people have problems with because of taking the narcotics. I have fortunately not taken any pain medication. I have a very high pain tolerance, and part of it is because I'm a redhead. So it takes a lot of anesthesia and very high volumes of narcotics to really get any benefit from them. A daily supplement in terms of a woman's vitamin or a men's vitamin daily, and lots of fluids are big after having this surgery. You will find that in the first 2 or 3 days, you're going to be going to the bathroom a lot. And I would recommend this for the men. I don't know what a woman's one looks like, but this helps not having to get up to go to the bathroom all the time, especially all through the hours of the night. So that's a that's a big one. Staying on the first floor is another one. Going up the steps can be a uh, a downfall. It could really slow your progress and create hip flexor tendonitis, as well as injury. I've fallen down the stairs after having a shoulder repair and had to have another surgery because I ripped all the anchors out. So stay clear of as many stairs as you can for the first month. Flip flops. Do not wear flip flops. I don't care if you think you're God and nothing's gonna happen, but things can happen. So don't wear flip flops. Shoes to wear are slip-on shoes like Vans. That's what I wear, because you don't want to be bending over after this surgery, because you want to be in a 90-degree position with your knee. You don't want your knee to go past 90 degrees in flexion for a period of time. Crutches, depending on what you had done in terms of your surgery, you might have had a microfracture, you might have had a labral graft, which I have had, and you might have had a labral repair, as well as psoas lengthening. So your protocol post-op may vary between um, pushing it sooner and pushing it later. I recommend the first few days, if you did have a labral repair like I did, taking the first couple of days to just kind of relax. Your body just went through a whole lot of trauma. You got instruments and water flushed in and out of your hips, so it's going to feel very waterlogged. That's where a lot of the urination comes from, because your body, kind of like osmosis, is sucking the water back in and you're pushing it back out. Um, so in terms of a diet, you want to keep a good diet, keep your body full of fluids. You kind of want to flush everything out. You should get a prescription for anti-inflammatories, which will help in aiding your bone not growing back, as well as anti-inflammatory and getting the inflammation down. A lot of doctors prescribe naproxen, 500 milligrams twice a day. Some doctors choose to go with something like meloxicam because it's not as hard on your stomach. So if you do take a naproxen and you have a problem with your stomach, try getting some over-the-counter PPR antacid uh, like opremazam. It's a you can get it prescribed or you can get it over the counter, but it's an antacid to coat your stomach so you don't cause any ulcers, because you can get ulcers from these medications, as well as taking a lot of pain prescriptions, whether it's hydrocodone, oxycontin, or Percocet. So you want to be careful with that. So a couple other things that you may need, or what I would recommend in having, other than a urinal container, antibiotics, medication, probiotics, a daily vitamin. Um, this right here, this nifty grabber, comes in a pinch. Picking stuff off the floor, just grabbing things that you're not gonna bend over and get. You're not gonna injure anything else. That helps a lot, especially if you drop something. The controller. A lot of people are gonna be spending a lot of time in bed. Right now, I'm currently laying on a wedge, and I'm pretty sure we all know what a wedge looks like. So I would really recommend getting a wedge. A lot of people have asked the questions and have said, oh, okay, what can I lay in while I'm recovering other than bed? Is a recliner good? Well, in my opinion, a recliner is not good. It's very hard to get out of, and you also put your hips, especially when you're leaning back, past 90 degrees, which is something you don't want to do. A lot of people say do what's most comfortable for you, but I would have to say that that's probably out of the realm of something I would do. So that's entirely up to you talk to your doctor. If he says it's okay, fine, by all means, go for it. I'm not here to tell you one way or the other. I'm just giving you a personal view and opinion of what to do and what not to do. Some other things. The first couple days after surgery, you're going to do some very isometric exercises. Um, Here's some bands that you can buy online. This one's called Starwood Sports. It's a light band. It's probably not something you're going to use for a while, but you're going to end up doing clamshells. That's going to be an exercise you're going to be doing a lot, and it's going to hurt. It's a pain in your butt, literally, because it's going to work your butt, your glute med and your glute mid. You're going to have a rock core ass after this, trust me. Um, Another thing that I would recommend getting is this. You'll probably see this in the physical therapy office. It's a strap that has holes in it. And this is going to help you with hamstring stretches, as well as quads and calves and a bunch of other stretches. You don't really want to go too hard in the stretching the first week. A lot of it is just regaining some of your modalities back in your range of motion. Let me see here. I have a hip brace, which I'm not wearing because I'm in bed right now, and everybody's probably seen one of these. They're infamous. They're a pain. You have to wear them all the time. It kind of sucks, but you'll really be glad that you did. Mine's set at a 90-degree angle currently, and I wear that for 4 weeks, 4 to 6 weeks, and then I'll get it off. A lot of people are non-weight bearing or 20% toe touch bearing. Some people are. It's very hard to say whether or not you're 20%. Do it as best as you can, but use your other leg to bear the weight. You're really going to want to heed that caution because you can flare up really quick. And this can be an up and down type of recovery. Another thing you might want, this ball right here. It's an isometric ball. This is something you're going to put in between your legs and contract your abductors to keep your muscles from moving. This is probably something you'll start on like day 3. And you might want to do it maybe 10, 20 times, a couple times a day. This is really going to help keep your muscles firing because as of now, everything's kind of shut down from having the surgery. And you just want to keep everything moving. Another thing you'll probably do is what we call glute sets. You'll lay in bed and you'll slowly tighten the glute on the side of your surgery. You want to keep doing that a couple times a day on and off. Keep the muscles really firing. And then what we call ankle pumps, where you're pushing your feet down and back, down and back. A lot of people get blood clots afterwards, and that brings me back to a medication you should also have is a very small prescription of like aspirin, children's aspirin, 81 milligram. You want to take that daily for a period of time too, because that'll help with blood clots. People have been known to get blood clots from this, and that can be very dangerous. So aspirin helps in aiding not having blood clots. Let's see. Another thing here. This blue foam is a stability foam, basically retraining your muscles to kick in. So this is something you're probably going to use slowly starting out when you're starting to get off the crutches to kind of contract the muscles, and you'll stand on it, 30 seconds on, 30 seconds off, and you'll be moving between both legs because you don't want to just do one side. With this recovery, it's really key that when you're doing some of these exercises, to do them symmetrically, so one side's not worse than the other, because my right side's still super weak, and I don't want my other side to be taking the compensation for it. So you really want to do everything to even it out. And then your crutches. Keep your crutches handy. Driving's another thing. You should have got paperwork for a placard for handicap. I got a handicap placard. I hate to say it, I actually don't use it, but I get it in case there isn't any parking anywhere. I kind of feel like I'm not as worse off as some people are, so I choose not to use it. But I got my nifty pictures here, and a lot of this is probably very hard to see because this isn't like 1080p HD quality 4K. So what I can do is I can show you what a labral repair looks like as my battery is getting low right here. Well, you know what? I'll probably show this at a later time when I get better pictures because it's kind of hard to see coming from there. I'll go over that later. But hopefully these videos will kind of help you. And these right here are something you get from your physical therapist. They're basically printouts of exercises that you do. So on the side of my room right here, you can't see, I have a board that I'm going to have broken out week by week, that has all these exercises on there. So people who are trying to rehab from this and kind of conserve their physical therapy visits will have an idea of what to do. And hopefully it'll help you as well as it helps me be structured in rehabbing this hip and getting back to just enjoying life and being able to do the things that I haven't been able to do for the last year, as it is mentally, it takes a toll on you because I have been on medical disability, due to the fact that I haven't been able to sit for long periods of time. So I left a pretty prominent career to kind of take care of my health first. Not everybody has that opportunity, but if you do have questions regarding that, I am really familiar with FMLA, short-term disability. And type of things that happen when you're going through work because I did struggle with this for quite some time. So feel free to respond, ask questions if I miss anything. Let me